Hi guys, Dr. Vince Hassel with Des Moines Hyperbaric Oxygen Therapy. This is Link. I wanted to take a minute to review his story, review his health, and his journey with hyperbaric oxygen therapy. This is a hyperbaric oxygen chamber. Someone doing a session in there right now. So, your health diagnosis, what was going on?
Well, it took over 3.5 years to figure it out. I was having all these really severe symptoms, organ-like failures, really, from breathing to digestion to bladder. And 3.5 years later, after 4 trips to Mayo, I found out I had severe autonomic neuropathy, right? So that's the breakdown of your brain's ability to communicate with your organs, and peripheral neuropathy.
Yeah. And so your health was declining, quite rapidly? Was it slow over time?
It took about 3.5 years, and I felt that I was on my deathbed.
Yes. And so with those trips to Mayo, solutions, was there, what was the prognosis? What was going on?
We did a tremendous amount of tests over those 4, and really the only thing they told me is most people don't get better, just don't get worse. I'm like, well, what's the point of that, right? I'm staying like this would be no point of living. But they gave me a nerve-like painkiller called gabapentin that you take every 8 hours, and it tremendously helped because I was in so much pain that I was grateful to get something. But that was it. They sent me home and they said that's all we could do.
And your last trip from Mayo was January or February of this year?
It was, the beginning of this year.
The beginning of this year. So as they sent you home, it was basically just, there's nothing else we can do for you and good luck.
That's pretty much it.
And then you started your hyperbaric journey there in that first part of February?
Yep, I was just doing research on, well, if there's nothing out there, what have I got to lose? Let's go try. And I saw the hyperbaric oxygen chamber that people with peripheral neuropathy were experiencing success. So I was like, well, the science behind it made sense in reading it. So I was like, let's give it a shot. I saw it on Sunday, found you on the internet that night, was in here on Monday morning.
And then now we're June 7th, and so it's been several months now. How are things going now with your hyperbaric journey and your health?
Dramatic change. Still have a long way to go, but I'll say this, the 5 days after I started having different issues, and I was like, well, what's going on with this? And I found out I was having issues with gabapentin. I was overdosing on it. I didn't need it, so I reduced it, and within 12 days, I was 100% off the gabapentin without any of that extreme pain.
Awesome.
So, like today, I can smile, I have some energy, right? Because before, it was just chronic fatigue, not being able to get out of bed for 3 or 4 days in a row, just because of the hypotension, right? You stand up, blood pressure would drop 50, 60 points, that's 90% gone now.
Awesome.
So just so many symptoms, still lack of balance.
Yeah, right.
I have a lot of issues, but
Yeah.
it's a night and day difference from February.
And really, when they send you home in February, it was really just kind of almost a hospice situation, right?
I mean, it felt that way, yeah.
Yeah.
There's Iowa City, right, I went through all the Des Moines doctors, I went through Iowa City, with the University of Iowa, I went to Mayo. For somebody, I mean, even if you're having an extreme situation, I told my wife, we just signed the living will and just said, there's no point in even going to the emergency room.
Right. There's
Nothing anybody can do but give you a painkiller or morphine. So
right.
that's just where I was at.
And so since February, we've turned the dial and things are going in a different direction.
Oh
with your
yeah,
health.
it's very strong.
Awesome.
Yeah.
Very good. Thanks for sharing. Yep. Thank you.